Okay, good evening, folks, and thank you for joining our webinar. We have been in the process of discussing both internally and with our state and federal.
Hold on. We are
Not
being. Colette, can you hear us in this room? Oh, yes, we can. Okay, go ahead. Sorry about that.
Okay.
I apologize.
I'll start again. We had a little bit of a glitch here. Again, I'm Carl Rutherford, District 5 Supervisor. Good evening, and thank you for joining our webinar. We have been in the process of discussions internally and with our state and federal counterparts under what circumstances and how we would come out of the current stay-at-home situation. Obviously, we will need to do so within the timeline and overall framework of both federal and state guidelines and health orders. Welcome, Supervisor Brennan, Chair of the Board. Would you like to make your comments now, or you want to wait until? Okay. So obviously, we will need to do so within the timeline and overall framework of both federal and state guidelines and health orders. While the governor today was not ready to set a timeline, we have recognized for several weeks the need to have a plan to come out when the time is right. Initial planning, as I said, has been going on, and today's webinar is our first in a series of weekly webinars to reach out and listen to you, the residents and business owners of our county. Our intention is to involve you every step of the way. Your input is absolutely essential to getting it right. The initial planning has been focused more on answering the question of what are the criteria that will determine the timing for coming out, and in developing a framework for coming out of our current status. Based on the federal guidelines announced late last week and amplified earlier this week, a phased approach is anticipated, with each phase having certain criteria necessary to realize in order to move to the next phase. Obviously, during each phase, our public health professionals will be assessing the changes in the health picture, and our planning will be updated accordingly. One of the key ingredients to the success in each phase and our ability to move from one phase to the next is the level of public compliance that we can get during this process. The level of public compliance we recognize is inexorably linked to the level of public buy-in to the process. Forums such as these serve the dual purpose of bringing more good ideas to the table and also engendering that essential public buy-in. Cole is going to moderate this evening's process. We will be starting off with some draft documents to serve as a point of departure for our discussions. These have not been worked on to any level of detail. They are basic templates, and we recognize that they are far from perfect. They're just something to get us started. If you have not accessed these, Cole can describe to you how to get to them for our discussion. Again, let me emphasize as much as possible, we need and want your input. Cole will also describe the process for providing that input during this webinar. Before I hand it over to Cole, I need to ask that you understand two very important relationships that we must be respectful of and sensitive to in this entire process. First and foremost, this is a whole of government approach. While we can lead the way in some ways and want to, we cannot get out in front of the state health orders. Guidelines are just that, guidelines, and provide us with some flexibility. Orders are orders, and we are obliged to comply. Second, we are dealing in vital regional partnership in coordination with Mariposa and Madera counties. That does not mean that one size fits all and that everything has to be exactly the same for all three counties. There is great benefit, however, as Yosemite Gateway partners to coordinate our efforts and those of the city with those other two jurisdictions. To the extent possible, we'd like to dovetail our efforts, and we intend to do that as much as possible. Those two relationships will help guide us our steps and will also help us to succeed. So with keeping that in mind, I want to thank you again, each and every one of you, for participating and in this most important webinar, and hopefully you'll join us in future webinars as well. I was going to turn it over to Cole, but I was anticipating following Chair Brennan, so I'm going to turn it over to Chair Brennan for her opening remarks. She was busy, as we all have been, on wall-to-wall teleconferences. So Supervisor Brennan.
Thank you. We just wrapped up our Yosemite Gateway Partnership meeting, and Supervisor Rodefer has already touched on a number of the key points in working with that group. And so I just want to reiterate how very happy I am that all of you are joining this. I hope additional businesses will come on board, because the success of reopening Tuolumne County is largely dependent on us hearing what you need and you understanding what the guidance is from the federal and the state government. Additionally, I want to thank Supervisor Rodefer for taking this on. He is completely engaged in this. And Mr. Presbola, of course, we thank you too for all of your efforts. The last piece that I want to emphasize is that while we are working on this Yosemite Gateway coordinated effort so that we are talking at the state level with a regional coordinated voice, we all recognize as partners in that effort that each one of our counties is distinctly different, and how we go about this will have some variation to it. And so we are just trying to maximize the influence that we can have at the state level with a coordinated regional voice, but really want to emphasize that each county understands that we are unique, and we will have some variations in our approaches to this.
So before, I do want to emphasize one other thing. This whole process internal to Tuolumne County is going to be a fully coordinated process between all of our various governmental agencies. We have Councilwoman Colette Such and Mary Rose Rudakanga on the horn as well from the city. And I don't remember, did we have a tribal, is Dorian?
Dori may be attendee today, but she's not a panelist today.
Okay. But the city council and the city administrator, city manager are panelists on this. So we are doing a coordinated approach within the county. So with that, Cole, take it away.
Perfect. So some points of order and just housekeeping. I see you've all found the chat, or quite a few have found the chat. Please utilize, if you see it, there's a little toolbar on the bottom. It says Q&A. That will be the best way for us to respond to questions and type answers that we get live from Dr. Ortiz. We will be taking those questions. I have quite a few on my computer. You can see I have lots of screens, so ways to get your question in are through that Q&A. You can text me at 209-288-4030. You can also go through email. I'm sending out my email as well, so if I'm looking down, most likely I'm trying to look at a question. And one of the things that I'm going to do is share a screen real quick. I am going to show you the Tuolumne County Disaster Assistance website. While you're at the webinar, you can go right here. This is all the different ways to access the webinar, because I know we've been having some Facebook issues, and so there may not be a Facebook live stream, but if you're still interested, the registration for the Zoom is open. There is a toll-free number. So if your video is not working, these are all the different ways to watch tonight's information. The other thing that we want to make sure you see is right here, this guidance for operating their COVID-19 documents. This is where these documents will live publicly for now. These will get updated. We will find a way to, if need be, have a history of what they were so we can show the differences. But this is where you'll want to go, and you can see if you click this link right here, it will open up that PDF. So that's just some couple housekeepings. Utilize this website. It has a lot of useful information going forward. And with that, I am going to go ahead and pass it over to Dr. Ortiz. I can unmute you from here, so I will go ahead and do that and let you kind of talk about what you would like to share before we get started with some Q&A.
All right. Well, before we get started, can you hear me?
Yes.
Great. If somebody could tell Cole or Shelly behind me, whether you do it in the chat or the Q&A, and just let them know that you can hear me before we, get too far down this road. And I'll let Cole or Shelly tell me we're good. Okay.
Yes, they can.
Thank you. So, good evening. As Cole explained, we have released some drafts. The keyword there is draft. And as Supervisor Rotifer has explained, we do not have final guidance or final orders from either the federal level or the state level. We must comply with those orders if they come down. When they come down, we will make sure that all of our guidance to local businesses complies with that as well. So while this is an initial step, this is not the final step, and we really want to hear everybody's input. We've gotten a few people sharing some things with Cole ahead of time, which we'll address a little bit of right now, but we'll also address things as they come up in the Q&A as much as we can. I understand that these are super general guidance documents. We expect that we will not only be given some specific sector guidance from the state level, but we expect that we will put out some variations that may apply to different sectors of business. We don't run the businesses, you guys do. So we want to hear from you guys. So just in general, little bit of repetition to what our supervisors have said. This is the planning phase for when we are able to modify the stay-at-home order, when we may be able to move around a little bit more, when we may be able to have different types of businesses able to engage in business a little bit differently than they currently are. What we expect is that no matter how they open up, no matter what phases get implemented on a state and federal level, we expect that social distancing or physical distancing will need to continue no matter what for a prolonged period of time. So this guidance takes that into account. A lot of people asked about where the 120 square foot guidance came from or where that number came from, and it's from having 6 feet between people. That is a number that's been used across the country in guidance. So that doesn't mean that this is the final version of what guidance will be given, but that's just where we're starting off with. And we understand that a lot of business-specific things will need to be taken into account. So that is the super basic high-level explanation. Thank you to the supervisors for explaining some of the other pieces of the government involvement.
Thank you, Dr. Ortiz. I will mute you back for now, and then we'll come back to you to start answering some questions. With that, I am going to unmute both Mary Rose and Colette Such, and I'll let you both kind of start where you need to go. So Colette, you are unmuted, and Mary Rose, you have been unmuted as well. You may have to unmute yourself on your screen.
Hi, good evening, everybody. Mary Rose Rujikonga with the City of Sonora. We're here together with Colette Such, our council member. I just want to reiterate what Supervisor Rutherford and Supervisor Brennan touched on in the beginning. You know, the City of Sonora, although we are a city, we are still part, obviously, of this county, and we strive to coordinate as much as possible with the county in ensuring that we are enforcing or allowing forth for the orders from the state and the federal government. With that, the guidance that are coming out for the businesses, we are doing in consultation with the county. So we are stressing that this will be a coordinated effort, that the guidance between the city and the county will be done together and sent out together. We know we have heard from the city level. We have heard quite a bit of feedback already from businesses within the incorporated area of Sonora. And we have relayed some of those concerns to the county through Cole and through our coordinating meetings that we have almost daily. And one of those questions, as Dr. Ortiz touched upon, was the 120 square foot recommendation, and how that would relate to small businesses. So that is something definitely that we're looking at, and we're voicing concern with the county in regard to that. But just so the businesses are aware, from the city perspective, in the next couple of days, we will be reaching out to our businesses within the incorporated area of Sonora to get updated information from our businesses so that we can easily contact you for any additional information that we're receiving of any lifting of restrictions or guidance that we are setting forth from the city. So just in case you're receiving phone calls or whatever, that's coming from the City Hall, and that's simply to get updated information on file from the city. Again, all of our efforts are going to be done in conjunction with the county, and we are one partnership with the county. Colette, if you'd like to add.
I just have one sort of quick thing. I'm just asking that everyone, and I'm speaking to everyone certainly on this panel, but also businesses, that everyone think creatively as possible to, certainly working within the guidelines of the state and the public health officer. But we need to be very, very creative here to help our businesses as much as possible, while always meeting the social distancing requirements. And I read something, I think yesterday, and it's just a quote. I always end things with quotes. I'm sorry about that. And it was that we must be guided by science, knowing that it's an imperfect science. And certainly in the situation that we're in this country, the science is imperfect just from lack of testing makes the science imperfect. But we must be guided by that first and foremost. That's it.
Perfect. Thank you, Mary Rose and Colette. I'm going to go ahead and put you back on mute for now. And one other point of request is that this Q&A, I'm hoping that we can keep it on questions pertaining to the drafts today. There are a ton of resources. There's a ton of financial assistance information on the TC Disaster Assistance website. There's many ways to find out more information for relief, or however you want to think of it. I'm going to put up a comment to Regina about how you can find more information. And so just wanted to make sure that everyone know that we're focusing today on those draft guidance. And with that, I think we're going to start having some questions being addressed. I would actually like to throw it to Dr. Ortiz first. If there's some questions that we received quite a few questions beforehand. If you want to address those first, you're unmuted. And then from there, I can start adding questions along. So you're unmuted. Would you like to start addressing any questions that you've kind of seen and that the business community is asking you?
So I'll just do some super general stuff, and then I'll let you ask me however you want to ask me the questions as they come in. Again, 120 square feet per person inside of the store is a very basic way of saying people need to be able to stay 6 feet away from each other as much as possible. The ability for your staff to be safe themselves and to be able to safely clean things inside of the business so that patrons can be safe is generally addressed in both Appendix B, which is for general businesses, and C for restaurants. And the other common question was about timeline, which I think we've all stated depends on what the feds and the state say, and the state very much has a current order that we cannot violate and has not given us a specific timeline at this time.
Okay, so that was, you addressed I've gotten quite a bit of questions about the 120 square foot guidelines. And so did you, had my head down, you addressed kind of how those came about and why they are, and maybe it addressed how we're going to work about it with restaurants and different types of businesses. Does that seem like something we should address on how that's about?
Yeah. So if people who are on the call, you know, are from a restaurant, I may have seen someone make a comment already. We're happy to address, you know, whatever they may have specifically asked, but we know that 120 square feet per person is super difficult in quite a lot of restaurants. And other jurisdictions have come out with different restaurant guidelines. This is just the first draft that came out from the Yosemite Gateway area. So some other things to consider are people obviously often come out to eat as members of the same household. They're often seated around the same table, typically. And so, you know, we can look at what is a safe amount of space around a table and how many people can be at that table, presuming that they're, you know, probably from the same household. So that's some of the stuff that has come up. What is most commonly put into many different jurisdictions is a limit of the number of people at one table as well. We don't want to have a table of 50 people. That would be terrible for infection control. And also for businesses to think about for your staffing, most guidelines also recommend trying to have one server deal with the table. So, you know, we're all used to, like, you know, being able to flag down a waiter and you know, get a napkin or a fork, and preferably to have one server deal with whatever table they're assigned also minimizes the risk to your staff and your patrons.
So I have another question that's specific to the 120 square feet is, does the furniture and equipment include the diner's table? So what does that furniture and equipment necessarily mean in this 120 square foot equation?
Yeah, so let's see how we can explain this. So imagine you have a building or a room, and you need to think about what is the space that your staff and patrons use. So if it's a closet that no one's ever in, that doesn't count. You know, so I believe in the restaurant guidance and in the let's see, I'm just gonna read this, guys. Calculate the maximum number of customers you can have in your business at one time while still allowing for adequate social distancing. Every person, employees, and customers should have 120 square feet of space. To determine the number of customers that can be in the business, you want to calculate the amount of open floor space, not including merchandise, furniture, appliances, and etc. So I'm just gonna, you know, have a big box store as an example that has really big aisles full of merchandise. That doesn't count as people space, but the aisle space does. So again, this is a first draft. So this is something we'll have to work with the businesses on in terms of, you know, answering your clarifying questions on that as well.
Yeah, Dr. Ortiz, Supervisor Rotifer, we really need to look at that because the math that I'm doing in my head here doesn't come close to 120 square feet. So, and especially when you take into account that shelf space and furniture and that stuff doesn't count. I'd love to have an offline discussion with you on that. I don't want to eat up everybody's time, but I think it's safe to say that it won't be any greater than 120 square feet.
Right.
And I think there's a good case to be made for something less than 120 square feet. So we're going to take a look at that as one of the takeaways from this seminar. Okay.
And I want to add, the Supervisor Brennan, and I would also just add that you not only look at that, but it might be two different table settings. If you have a family come in that is already sheltering together, that's a different circumstance.
All right, so Dr. Ortiz, I'm going to bring it back to a very basic question on all of this, on these draft guidance for operating during a business with COVID, is will non-essential businesses be able to reopen and follow these guidelines as well? So are we talking essential and non-essential? So maybe you can dive into that a little bit.
Yes, this is the plan for all businesses. Well, this is the draft plan. Let me reemphasize.
Right. Perfect. And then there's a question of, is there a time frame?
And again,
And this could be a time frame of when these drafts will be completed. There's a draft. I know we're waiting for the state, so why don't you go ahead and kind of reiterate and explain what's the time frames like?
right. So as for, how frequently will these drafts be able to be updated? Quite frequently. And Cole, and you may want to speak more about how frequently you plan on communicating with businesses in the coming weeks, which is frequently. And so we can update businesses throughout that process. As for the timeline of when this will happen, that, as we've stated, is up to the state.
So, and this is Supervisor Rutherford again. Cole and I have had some of that discussion already, and we are anticipating, as I said in my opening remarks, at least a weekly webinar, much like this one, and hopefully we will have products out that have been modified based on the previous webinar, and we can do that iteratively as we go forward. In addition, Cole and I have also talked about reaching out to some of the business leaders, chambers of commerce, and some of the other folks to get their inputs as well. And we'll be doing that offline from these webinars in addition to what is covered on the webinars. So it's going to be a multifaceted approach, and it is going to be an iterative process, and we are going to include the public at every juncture that it is feasible.
I would like to share again that these draft ordinances are up on Tuolumne County TC disasterassistance.com, and they are right under, I'm sharing the screen one more time, right here at the top, where they say guidance for operating during COVID documents, and it's reopening guidance drafts. So again, I just wanted to share that for the people who have been joined in the last few minutes. Dr. Ortiz, let's do a couple specifics. How about, we get a lot of questions about bars and tasting rooms.
So, yes, these drafts and what will eventually become guidance will apply to bars and tasting rooms. We don't know what the state is going to say in terms of when they reopen and who gets to reopen. We have to follow what they say at a minimum.
Okay. And then I think my guess is it's going to be very similar, but is there anything different for, we hear a lot about golf courses, right? And so I'm just kind of addressing, there's quite a few topics that keep coming up, and so golf courses is one of them.
Yeah, rules for physical distancing will also apply to golf courses as businesses.
Okay. And then the other thing that I get asked a lot is this idea of how we are addressing big box stores versus our mom and pop small businesses. My guess is it's similar to the essential, non-essential discussion, but maybe you can address a lot of the business community's concerns about the difference between some of our national stores and franchises and our small businesses.
Yeah, so we expect that as we move forward and our more businesses are able to be open, as the stay-at-home order gets modified, that the vast majority of places will be able to be in a phase where they open. Physical distancing rules will still apply to everyone. We want to hear about the concerns for smaller businesses, because we want to be able to advocate for those specific issues on the state level. we know some of them, but the more you can tell us, the more we can advocate.
So this is Supervisor Rotifer again. I think one of the real challenges, because I'm not blind and I do get around within the guidelines, obviously, but one of the challenges that we are going to face, and we need to be willing to take it head on, is the fact that some of the essential businesses that have been open are not operating under these guidelines, and they're going. Our intention, I believe, correct me if I'm wrong, Dr. Ortiz, but our intention is that if the guidelines apply to a business, they apply to all businesses.
Absolutely.
Obviously, there may be some, if a mask is required, it's hard to eat dinner in a restaurant with a mask on. So obviously, there may be some exceptions based on whatever these guidelines end up being in certain sectors of our businesses, but whatever the guidelines are should apply to everybody.
That is absolutely correct.
Thank you.
So the other questions, we're going to kind of now go back a little bit to there's some more questions about the 120 square foot. Is that how long will the 120 square foot be a part of this conversation? And if we reduce it, is there a timeline of these guidances that we've been talking about?
Sure. So a little something that I'm not sure the supervisors addressed at the very beginning, and this is just a higher level roadmap thing, is that not just for businesses, but for most aspects of our lives, there will be some phases of how we return to the new normal. So right now we're in a very restrictive phase. We anticipate that we're going to be able to loosen things up a little bit, and for lack of an official term, we're just going to call that phase one. There are not official terms for this yet. So phase one, say is 120 feet and no more than X number of people and no gatherings of more than 10 people. And if that goes well, for the amount of time it takes for us to be able to measure the amount of disease transmission in that time, which is around 20-ish days. If that goes well, then we can look at loosening things even more. So some of that stuff gets into, right now we're in a phase of no unessential travel should be happening. Eventually that will change. We don't have specific rules from the feds or the state on how exactly that's going to phase out. So I don't want to say phase one is this level of travel, phase two is this level of travel. We have some proposed ideas. Just like we have this, proposed draft that we know we need to have social distancing. And as we are able to say, oh, we're doing okay, we're not increasing the amount of disease transmission, we're not overwhelming our hospitals, we're not increasing the death rate from this disease drastically, then larger groups of people or more people in places can go into effect, and changes on where you can travel can go into effect. So hopefully that makes sense to people. If not, I can continue to try to explain that.
And so for all of you that are on the webinar, on that same site where the two documents that we're working with tonight is also our distillation, so we could get it on a fewer pages, of what the federal guidelines are at this time, recognizing that this is a fluid situation and all the guidelines will change as we go down the road. So, but what the president put out most recently is actually on there, so you can kind of take a look at how he envisions, they're up there, okay, how he envisions the various phases going. Again, the state will have their cut at it, and then we'll have our cut at it as well.
The other thing to mention is the better we all are at, following the guidelines, the faster we can move through the phases. If we move through the phase and it doesn't go well, we have to go back to a little bit more restrictions. Not likely the level right now, but we can't move quickly through the phases if there isn't compliance.
So let's move to recreation. There's a lot of questions about the parks. When will they open? How does this play into our essential, non-essential? It's going to bleed into questions about hospitality. So why don't we start with how this kind of works with our recreational opportunities up here in Tuolumne County that a lot of our community thinks, and it is very important.
It's some of our favorite things about Tuolumne County is the recreation available up here, and I totally understand. Again, I apologize for having to repeat this. We do not have the rules from the state in terms of what they're going to allow us to do. As we just stated, looking at phases, right now we're in quote unquote essential. Is the only thing that's open, and we're looking at different things will open slowly and get reassessed as we go through phases. We can't state that we know when recreation of the parks will open. In whatever capacity places open, they still need to comply with social and physical distancing. The good thing is that a lot of outdoor places are great for physical distance.
Okay, and then how? Oh.
Well, I'd like to tag onto that just one consideration that I think needs to be in our thought process as we go through this is one of the things that if we're still concerned, again, not knowing when we're going to start moving through the phases, but if initially we're still concerned about migration of the disease up here from hot spots, we need to recognize that when we do open recreational facilities and when we do open up our lodging capacity, and especially if Yosemite opens up, we are going to be the strongest magnetic force in the universe for drawing people up here. And if we're drawing them from hot spots, that may not be what we really want. So we have to make some of these decisions and figure out maybe some other ways that we can control that migration. And probably we're going to need the governor's help on that because it'll have to be a statewide kind of thing. So
I would agree with that, but I also think that we have some variation that we consider with even, here within the county. A campground is different than a cabin, is different than a hotel.
Absolutely.
And so that's where I'm going to really be hoping that our community helps us, that recreation community helps us with some of these suggestions and thinking outside of the box.
And we're anticipating putting together another group to specifically address the lodging and the recreation aspect of it as well. Not that we can't talk about that here today, but we do recognize that that's an area that needs its own focus.
And if I may, we're hearing a lot of feedback from the city level about the short-term rental vacation order and how that's going to play into everything. So thank you for bringing that up. And I'm glad, Supervisor Rutherford, you're talking about that, of looking at that specific industry, because we are hearing a lot of feedback from the city, in particular on that short-term rental and lodging issue.
Yeah, and we all recognize that that is a huge piece of our local economy. And the sooner that we can get that up and running, the better it is for everybody. All the businesses benefit from our visitation. We just have to figure out how to do it wisely.
The one other one that's in, we talked about short-term rentals, we talked about, the other one that came up, Dr. Ortiz, was campsites. Can you just address campsites? Maybe is there ways to, are we going to be talking about modifying how they can spread out and maybe close one site so that they're spread out by sites? So just know that there are interest in also talking about campsites and how they fit into these draft guidelines.
Absolutely. And as Supervisor Rotifer said, we expect to have some sort of sector-specific conversations about what are the issues in different recreational areas and lodging areas. And as Supervisor Brennan said, a campsite is different than a cabin, is different than a hotel. There are some very remote places to camp, which some of us really like. And that may be able to open, you know, in a different way than a hotel in a larger, denser area. So maybe it turns out that it's every other campsite if they're that close to each other, although most campsites have 6 feet between them. So, but it may be about like what are the facilities available at the campground, and how can those be adapted, or can you open it and just say that you can camp here because you're going to be more than 6 feet away from other people, but you can't use these facilities because they can't be contained. So we're looking into all of those differences and advocating on the state level for them to be considered.
Great. So I'll reiterate it one more time because I just got another text about another specific industry. Carl and I will definitely be working with Dr. Ortiz to schedule very specific different segments of our community about hospitality and however you want to go about it, so we can definitely do these very specific questions, because at this point in juncture, I am down 70 questions in answering. So we're not going to be able to get to every specific type of industry tonight. And so while I'm still watching this chat feature in the Q&A, most likely what's going to happen is not every single question is going to get answered tonight, but every single question will get answered. And I will put this Q&A into a blog, into my Motherload, into your emails if you're interested. So know that if your question doesn't get answered tonight, it will, and I'll personally try to get it done through all this Q&A.
I also just wanted to say one quick thing that we haven't really touched on, which is sort of like we're talking about some campgrounds being able to easily be able to demonstrate 6 feet between people. There are a lot of aspects of small business that can adapt a little bit better. So, you know, when you think about a relatively small hair salon that can handle one person at a time, that's not going to happen in some big cities that have huge places where they're right on top of each other. So just to sort of give a little bit more of an optimistic note that there are some ways that being in a rural area, having smaller businesses can be easier to physically distance. We typically have more physical distance between us than big cities.
So I want to switch to questions about personal protection equipment, hand sanitizer, face masks. How are we going to address that in these guidance? And then also, how do businesses, maybe if you have a suggestion on how they come about finding those materials, because you hear a lot that A, you can't find it, or B, that the prices are inflated. So maybe first cover what it is, if any of those draft guidance kind of cover PPE, and then how can we help suggest acquiring such materials?
The draft guidance briefly covers protective equipment for staff. Again, we don't know what the state rules are going to be. You know, I'm just saying this purely hypothetically, just so that people can understand. It's entirely possible that the rule is everyone will need to wear masks all the time except for if you're eating. That is a total hypothetical. But if that's the case, then we have to work within that. So we will have to work with whatever guidelines are set forth for PPE. You as a business and the county and the city could be more strict if they felt that that was more appropriate. As a private business, you may choose to say that, you know, your employees should all wear a mask, or people should all have a piece, you know, your employees should have a piece of plexiglass between them if that's applicable in your type of business. So right now the guidance is pretty light in these drafts in terms of PPE. You're going to need more PPE or protective equipment or modifications in industries where there is more close contact, obviously. You know, there are examples of you know, businesses that have the ability to physically distance and don't need that much PPE. So some of that is going to vary depending on what kind of sector you're in. As for the supplies, we expect that there will continue to be a recommendation that disposable medical grade personal protective equipment should be reserved for healthcare responders, as that is the very highest level of risk as an occupation, and we're trying very hard to retain our healthcare capacity. Cole, let me know if you want me to go on.
No, that's good. Can you address the difference between a mask, a face covering, or an N95 mask, or is that a homemade cloth mask? Can you address the differences and maybe where we're at in the guidance draft?
For this non-healthcare business guidance, whether it's a restaurant or any other type of business, we're talking about non-medical level personal protective equipment. For the most part, that's cloth masks covering your nose and mouth. Not talking about what is called an N95 respirator, which is what is direly needed for healthcare workers.
So I think one of the things that we could, because the questions can go on and they're very, very specific to each industry, but one of the things that I keep seeing that's getting asked is, can you outline one more time how we get federal guidance, how the state then kind of works with that federal guidance, and then how we can then how we interpret or utilize both, and where's the rules and where's your guidance, and how do we make decisions based on federal and state?
Yep. So first I'll make the distinction, guidance versus order. Guidance is recommendations. Orders we have to follow. And then I'll also say on every level, the higher level of authority, whether that's the feds or the states, if they come out with an order, we can go stricter, we cannot go looser. So the feds have pretty much put out guidance and do not have final guidance out yet. The state has put out indicators for what they're looking at when they are going to make some changes in the stay-at-home order. They have not given us final rules yet. They have not given us final guidance yet. They have not given us final orders yet. What we currently have in place is a state stay-at-home order that we cannot be looser than. We expect that it will be modified relatively soon, which is why we're planning. And whatever the state comes down with in terms of guidance and rules, we may go stricter, we cannot go looser. And because those rules are not final, this is a great time for us to advocate for things that are specific to small counties, small cities, and small businesses.
And Cole, I'd just like to add from the city perspective, you know, even though we are the unincorporated city, we are under the guidance of the county public health officer. So her orders and the state orders and the federal orders, our guidance, apply obviously to the city as well. So we're under the public health officer in the city as well.
Cole, if you guys are saying anything, we can't hear you.
Can you hear me now?
I can.
Okay. I just wanted to assure everybody on the horn that every single day, your supervisors, your county staff, and I'm sure I can speak for the city council and their staff as well, are advocating at the state and the federal level as hard as we can to do what Dr. Ortiz as much flexibility as she can get, so we can do what's right for this county. I am really heartened by how well our governor and the president are working together, and I am very heartened that the president's message is very clear. It's federally supported, state managed, and locally executed. And on his last week's call or conference, press conference, the governor said at least 3 times, localism is determinism. So I think I'm going to kind of hold them to their promise. I think we're going to have as much flexibility as they think that they can afford to give us, and we're hoping for that. But we are advocating for that.
We're advocating, and we want to show them that we have a plan when the time is right.
Exactly.
Yes, we echo that as well from the city.
So one of the last things I kind of want to address, and this might be for Dr. Ortiz, but also maybe our 2 supervisors, is it comes up quite a bit on enforcement. So based on having guidance drafts, and businesses get to use this guiding drafts once they're finalized and ready to go, how does this be enforced? How does this work? Maybe you want to address that.
Sure. Supervisor Rotifer and Chairwoman, feel free to jump in, and also Colette or Mary Rose, you can also jump in. My personal preferred method of enforcement is community enforcement. If we're going to get through this, we need to get through it together. Quite frankly, we don't have enough sheriff's deputies to patrol every business in this county. So if you're a business owner and we give you a set of guidelines or rules to follow, we expect you to enforce that within your business. And if you don't, then we'll have to figure out how we're going to deal with that. But honestly, as we said in my opening remarks, public compliance is going to be what gets us to the next phase in as quick a fashion as we can. If we're not complying, well, one, we're probably not going to reach the criterion to go to the next phase because there's reasons for what we're putting out there. So part of this whole effort is to build community buy-in to what we're doing, so that you will comply on your own and that we will community enforce. Beyond that, we'll deal with the situations as they come up. But this will not work if we're not all in this together.
And so I would add that the flip side of this is the piece that Supervisor Campbell is working on, which is really looking at what is the latest recommendations. I know his group will also be working with Dr. Ortiz, but as Supervisor Rotifer said, I think that business's success is going to be built on the trust that your patrons want to come back in. And so that trust is really going to be a two-way street, and that two-way street has to be built on accurate information. And so that's really, in structuring this, both pieces are important, and then Supervisor Rotifer and Supervisor Campbell will be working together jointly again with Dr. Ortiz in how these two pieces come together. So I would echo his sentiments that we all need to find a path where we have success and build the trust so the patrons will come back into the businesses.
Colette, you want to speak to that?
You're
Is she
muted.
You're muted.
Can you unmute Colette?
you know, the
There
main.
we go. Are you asking me to speak to that from a medical perspective or just a city council?
No, the question had to do with enforcement and,
Yeah, right. Well, I mean, I agree with what's been said. Enforcement has to be, you know, the community has to enforce this, and this isn't going to be successful without compliance. You know, we have gotten, you know, we've done really well up here, not necessarily with compliance, but with lack of positive tests. I think we've been a really lucky community, and I think the social distancing and the stay-at-home order, I'm grateful that we've had that, although the economic toll has been disastrous. But we need to stay the course and open when you know, when we're instructed that we can open, but do it carefully and not assume that we will not be affected by this virus in terms of our health. So I think the community, I think that there are many people who are frightened to go back into businesses. So it would behoove all of us to follow the guidelines that Dr. Ortiz sets for us.
and I'll just add one thing. The absolute worst thing that I hope we don't ever have to do is go backwards. You know, and that's why compliance is so important. If we have to go backwards, it's going to be way more painful than it was the first time. So, Dr. Ortiz, did you have anything to add on that?
I'm assuming you guys can hear me. Just like give me a thumbs up or something. Okay. So first off, I have to continually commend this community and how much
Absolutely.
they have done for each other and how much they have cooperated with this huge sacrifice that everyone has made to protect the safety of our community and our vulnerable populations. The nightmare sort of scenarios from the initial models looked really, really bad. And we know that the sacrifices that this community has made have saved lives. So thank you. We can't really say that enough. And we understand that slowly getting out of that will require continued cooperation and sacrifice. The more we continue to come together as a community and to think about our community members, the faster we will get out of this, the safer we can keep each other. Even though that means it's 6 feet away. And I get it, because there's a lot of people I have not been able to hug, and I've been back for like 2 weeks. So thank you to everyone on the community level and also on the business level. We understand that this is a massive sacrifice, and we know that you all want to keep your family safe and your employees safe and your patrons safe. And so we know that you guys will all continue to work towards that. And we're hoping that, you know, as you guys see other ways to keep your patrons and your employees safe that, you know, basic square footage is not covering, we need to hear that so that we can share that with the state. And please know, as Supervisor Rotifer was saying, we are advocating the heck out of this. I was on a call last night, and it was pretty much all rural counties trying to get their point across on the state level. So we're small but mighty. So I think that mostly summarizes it. And just to reiterate again, this is a draft. So please comment.
So Liza, I'm sorry, Supervisor Brennan, I have one more piece that I hope you talked about these very industry-specific conversations, hospitality, recreation. I think there is a group that needs to be addressed also, and that's the churches. And I would think that, again, I would hope that they would be one of those other conversations. Give them, let's find an opportunity on how they might be able to get back into business, if you will, and looking outside of the box. And so please add that to as a special category.
Sure.
Point taken.
Yeah, I was actually going to bring that up. We've been hearing, please take that into consideration from our, local churches downtown. So yes, please, when we're looking at those guidelines.
So before I let the both you supervisors wrap up what we got going on today, I want to just finish with a few bit of housekeeping from my end, is that I will coordinate. I did my best to answer a lot of the questions that were asked in the Q&A through the live event with Dr. Ortiz and the supervisors. But what I will do is go back and work with our public health department to actually get a written response, hopefully, to each one of these questions that have a pertainable question. Again, I'll reiterate, if you want to get more information, please visit that tcdisasterassistance.com website. I update it daily. I will keep adding more information, and those draft guidance will keep getting updated on that site. If you want to get daily, weekly updates via email, please send me your email address, and I will add you to that list so you can have that information directly sent to you. I am always available via cell phone, 209-288-4030. I have and still will always answer any of your questions that pertain to this guidance as much as I can, but also I saw questions about SBA Economic Injury Disaster Loan, Paycheck Protection Program. Any of your questions about any of the different programs, please reach out. I'm happy to help. And so, like we said, keep your eye out. I will keep sending out information. We are going to have more specific segments and industry-related information and webinars, and I will continue to host those with Supervisor Rotifer. And so I'll pass it off to you to have some final comments, and then pass it off to Supervisor Brennan.
Yes, I do have one thing. This really, and I expected it, this really turned into a question and answer session. But we really are, if you're a business owner and you want to make an input into this process, we are very, very interested in your input. You can email it to either Cole or myself. Probably better to Cole because he's kind of focused on this like a laser. I'm focused on it with like a flashlight maybe, but it is important to both of us. But we are interested in your input. If you have a concern with how we're going, and we already know that 120 square feet is a concern, so we're going to work on that for everybody. But if there are other concerns that haven't come up today or to this evening, please get them to Cole or myself, and Cole will be responsible for sharing those with the city and other jurisdictions as well. And again, we want this to be a very open and public process. We value your input. You're really the experts. You're the ones that have to run your business. And so you know better than anybody how best to do what we're trying to do, which is basically have some semblance of social distancing when we open back up again, okay? With that, I'll turn it over to, I'll let Supervisor Brennan go last. I'll turn it over to either Colette or Mary Rose, whoever wants to speak for the city.
I'll go ahead, Colette. We just want to, thank everybody for their continued compliance and all this. We understand what a hardship has been, and we also want to say thank you because we did receive a fair amount of responses to the original guidance, that were set up. We were able to address some of the concerns with the county. So thank you. If you have additional questions, if for some reason you can't get a hold of Carl, please continue to address those concerns with City Hall. You can, reach me or the Community Development Department. And we as a city will continue to advocate for our businesses downtown. We know you guys are unique merchants and all of the businesses in the city when we are putting forth this guidance together with the county. So thank you once again for your continued compliance with the orders, and please keep those questions coming to us.
Okay. Supervisor Brennan.
So I would end with thanking everyone for participating in this process and remind us of a couple of things. I think when I listen to the governor's comments, the next 10 to 14 days is really going to be critical in how he looks at his phasing. And if we can keep those numbers in our area like we have, that's going to be really beneficial to our ability to start coming out of this. The other piece is, I know you will be hearing from Supervisor Rutherford and Cole on a regular basis because this is going to be moving quickly. And our opportunity to be advocating on our county's behalf at a regional level happens every couple of days. And so this isn't something that we're going to be sitting on in any way. We need to be getting these draft plans formulated, putting some meat on the bones, and then advocating, and that's going to be happening in a rapid fashion. So stay engaged. We need your help. It's critical to this process. And thank you again for joining.
Dr. Ortiz, you got any closing, anything you want to say?
Thank you for your cooperation. And I hate to be the bearer of bad news, but the stay-at-home order is still currently in place. But it is working. We have saved lives through these sacrifices. So thank you very much. That's it.
Okay, so folks, thank you very much for your participation, and keep those cards and letters flowing. And with that, we're signing off.